For more on this story, we're joined by global health expert Gavin Yamey. He's at Duke University in North Carolina. Dr. Yamey, good to see you. As we just heard, these variants are causing problems in several countries. And despite the fact that tens of millions of people have been vaccinated, we're still seeing a rise in cases. How do you explain this?
Well, thanks for having me back on, Monty. I mean, that's right. You saw the grim news that we have surpassed 3 million deaths yesterday. And in fact, cases have been rising globally for the last 6 weeks. And in many countries, we are seeing surges. We're seeing surges in states in the US, like Michigan, provinces of Canada, like Ontario is just heard, and then many countries, Brazil, Turkey, India, Iran. Probably a combination of two things, Monty. The first is public health measures being relaxed too soon. We know public health measures work. They've worked in many countries. Everything from high filtration masks to test, trace, isolating people who have been infected, quarantining those who've been exposed. We know that avoiding being indoors, we know that ventilation works. There's a whole range of measures that work, and these were relaxed too soon in many nations, together with virus variants that do appear to be more transmissible. We saw a surge, for example, in Britain in the winter, an awful surge, in part driven by a variant B.1.1.7 that is more transmissible, perhaps more deadly, although the science on that is still contested. So you've heard this expression that it's a race between the vaccine and the variants. And that's really what's going on. We need to vaccinate people as fast as we can, and we need to use public health measures judiciously.
You mentioned the variants. What do we know about the effectiveness of these vaccines against the variants? And have there been some that have been shown to work better than others?
So that's a really important question, Monty, and I think it's really important for your viewers to know that the vaccines work against all of the known variants. You know, there's a term that Eric Topol at Scripps in La Jolla, a researcher who's been very visible during this pandemic, he uses the term scariant. You know, we hear about things like mutant viruses, and we can get quite scared of the news about these variants. The important thing to note, the profoundly important thing to note, is that the vaccines, all of them, Pfizer, Moderna, J&J, AstraZeneca, they are effective against the variants. And so, for example, Britain and Israel had awful surges. They were able to drive down cases using so-called lockdowns or stay-at-home orders, circuit breakers. The circuit breakers drove the cases down, and then their very aggressive vaccine rollouts accelerated the decline, a kind of a 1-2 punch. And I think that has to be the playbook for countries that are struggling right now, a combination of public health measures and vaccination. So even, for example, in South Africa, you will have heard about a variant there, B.1.351. The J&J vaccine was found to be 85% effective, profoundly effective in preventing severe disease with that variant. The vaccines work. We need to roll them out as fast as we can in combination with public health measures.
We're running out of time, but I did want to ask you, some nations are doing well with their vaccination campaigns, but that's not the case everywhere. I know you helped craft the COVAX program to level the playing field. What's the status in less wealthy countries?
Yes, so that's right. There is global vaccine inequity. It's been termed vaccine apartheid. The rich nations are hoarding vaccines, and they're blocking the poor world from making their own vaccines. Hoarding and blocking. COVAX is attempting to redress that. It is trying to vaccinate 2 billion people by the end of the year. Things are moving along. They are slow in part because of the hoarding of doses. I was thrilled to see 2 days ago that New Zealand will donate enough doses to vaccinate 800,000 people through COVAX. That is the kind of global solidarity that we need. And once again, the New Zealand Prime Minister, Jacinda Ardern, is showing the way. We need more leaders like her.
Okay, global health expert Gavin Yamey at Duke University. Thanks so much for your time.
Thanks, Monty.